Always low prices at Pahrump Valley Auto Plaza.
Today, we remain out of flag status in Nye County. There have been additional new cases received, and there's a report of one additional death. Vaccination-wise, we have vaccinated over 24,000 people. We are in an initial stage of transitioning, as we may recall, we talked about this about 2 months ago, of our plan to transition back to the health side of the house and away from DEM. That coincides with what the state is also doing. So what that will look like, our county health nurses will pick up the additional slack on the lowering numbers and then lowering requirements for ordering product, the pods, and also vaccinating within the county health nurse offices in conjunction with our medical providers, our clinics, our pharmacies, the hospital, etc. DEM will not be divorced from the process. We will continue to vaccinate regularly for the second dose pods that are already prescribed on the reverse side of their cards. We will also be holding first dose pods every Wednesday from 7 a.m. to 10 a.m. at DEM on Ceres Lane. So it's every Wednesday, 7 to 10 in the morning on Ceres Lane, and we will hold any necessary pods that would need to be completed throughout the remainder of the county as well. So if we have a target hotspot, we will address that immediately, assemble our traveling team, and go out and handle those issues. We will be managing all 3 vaccines. That will be in alignment with the requirements for the Pfizer product and for those that are 12 to 18. We will also, of course, have the Janssen single dose, and we will have the Moderna, which we've been using historically. We continue to push hard at max capacity for those to be vaccinated. As I don't really want to get into masks at this moment because we're going to be addressing that a little bit further, but that is an evolving situation that is on multiple levels being addressed and reviewed and for guidance purposes. So we will be monitoring that closely. But the vaccinations clearly hinge on some of those requirements. We are out there, we are still vaccinating, we are still testing where necessary. The majority of the tests are those that are actually going in for pre-surgical events. They're all gone out because they simply don't feel well and they're tested as a result, or they're in facilities and they're being tested when they're being brought in from other areas of the country.